Based upon anion gap, we can classify metabolic acidosis into high anion gap metabolic acidosis and normal anion gap metabolic acidosis. Okay, and we all know that the anion gap formula is sodium plus potassium minus chloride plus bicarbonate. Okay, so the normal anion gap in case of dogs is 12 to 24 milliequivalents per liter, and in cats it is 13 to 27 milliequivalent per liter, and this range can differ from species to species. So in order to consider it as a high anion gap metabolic acidosis, you need to get value above 24 in case of dogs and above 27 milliequivalents in case of cats. Coming to high anion gap metabolic acidosis, primarily bicarbonate is consumed by a non-volatile, non-chloride containing acid. In high anion gap metabolic acidosis, chloride is not increased. Chloride tends to be normal in range, and most commonly high anion gap metabolic acidosis occurs as a primary acid base disorder rather than a compensatory mechanism. Most common causes include acid production. If you take endogenous acids, you have lactic acid which is produced due to anaerobic metabolism, and that causes lactic acidosis, correct? And we have uncontrolled diabetes. In that case, you will have diabetic ketoacidosis. And if the patient is having renal failure, you will see high number of phosphates and sulfates that can contribute to high anion gap metabolic acidosis. Coming to exogenous acids or acids that are produced as a result of toxicity, best example is ethanol, methanol, ethylene glycol, and you have salicylates. All these toxicities will produce a toxic metabolite as end product, and that is going to give you a high anion gap metabolic acidosis. And we have normal anion gap acidosis. Here there is loss of bicarbonate or gain of acid that contains chloride. The best example is hyperchloremic acidosis. Here the anion gap, when you calculate, it always comes within reference range, and chloride is usually increased in normal anion gap metabolic acidosis, but you don't see accumulation of non-chloride containing acids like high anion gap metabolic acidosis. Okay, this normal anion gap metabolic acidosis can not only occur as a primary acid base disorder, but it can also occur as a compensatory mechanism to primary respiratory alkalosis. Some conditions that can cause normal anion gap metabolic acidosis are diarrhea, small bowel diarrhea, use of carbonic anhydrase inhibitor, and renal tubular acidosis.